via stream and also to the members of the media. As of this morning, confirmed cases of COVID-19 is 94, and those cases have raised to 15 in Wyoming counties. This is a significant cases increase from 1 week ago. It is clear that COVID-19 has arrived in Wyoming and is most likely present throughout the state. We have had 16 hospitalizations from COVID-19, and I just heard of an intubation in the northeastern part of the state. There is some good news to report. Some of those who were hospitalized have been released. Out of the reported cases, 24 people are now listed as recovered. At last week, more than 2,000 test kits were shipped around the state. A lot of that is due to the good folks at the Wyoming Department of Health. On Friday, I extended the 3 statewide orders that we had issued before, extended them through April 17th. Obviously, President Trump has extended his to April 30th. Dr. Harris and I confer on these orders, and it is absolutely imperative that they be respected. As most of you are no doubt aware, the guidelines for April 30th are now in effect federally, and at this time we are considering whether we want to extend our orders to correspond with President Trump's. We are taking stock of the situation daily and will make recommendations as they become clearer. We continue to distribute personal protective equipment from the state inventory, and now we have had 2 shipments from the Strategic National Stockpile. We have distributed those shipments to counties and to tribes, and we are working with FEMA as well as utilizing outside resources to secure additional supplies. I do want to recognize the contributions of Wyomingites who have taken it upon themselves to assist with our efforts. There has been an effort at UW and through other organized groups, including those in Sheridan, to do 3D printing of protective masks and face shields. We also have volunteers around the state who are willing to sew masks and donate personal protective equipment on their own. I think it's important that we speak frankly about testing. I did so today on the White House call with the President and other governors. I wanted to talk about our capabilities and what it's revealing. In an ideal situation, we would be able to test every person who presents symptoms consistent with COVID-19. Unfortunately, that is not the situation here or anywhere else in the United States. I want to take a bit of this time to turn this over to the medical professionals who are here with me. But let me just, before I introduce Dr. Harris, let me say that our medical providers will continue to prioritize testing based on CDC guidance, and that means that the Wyoming Public Health Laboratory will continue to prioritize testing those who are high risk or healthcare workers with potential exposure. And with that, let me turn this over to Dr. Harris to talk a little bit about the medical matters. Thanks.
Thank you, Governor Gordon. As Governor Gordon said, we had 94 reported cases as of this morning, and I would not be surprised if we have at least 100 by the end of the day. A week ago, we had 26 cases. So we've tripled in just a week because of increased testing and because of increased disease. We know that there are more cases than we have detected. There simply aren't enough supplies for everyone to get tested. Though most people in Wyoming have a likely source of infection, such as travel or contact with a known case, there are others with an unknown source, meaning it is likely they acquired it in Wyoming through interactions with their communities. That means we are talking about community spread. Because we know not everyone who may have COVID-19 will get tested, I think it's important to provide some guidance on what you should do if you're sick. We know people who are age 65 and older and people who have medical conditions such as heart disease, lung disease, diabetes, and weak immune systems are more likely than others to get severe illness. However, we also know that anyone can get sick and has the potential of having a serious illness, and anyone who is sick can pass it on to others. If you're sick, stay home except to get medical care, avoid contact with other people in public areas, and keep yourself away from other people in your household as much as possible. Stay in touch with your doctor by phone. Your doctor can help determine whether you need to be evaluated further. Cover your coughs and sneezes, wash your hands often, avoid sharing personal household items like eating utensils and drinking glasses, and clean high-touch surfaces in your home every day. We have had questions about how this virus spreads. We're still learning, but we do believe that people are the most contagious and are more likely to spread the virus when they are having the most symptoms or when they're the sickest. Some spread may be possible before people show symptoms, but this is not thought to be the main way the virus spreads. The public health orders that we've written and the social distancing measures that Governor Gordon talked about will help prevent spread of COVID-19 in both of these cases. These measures include staying home as much as possible, not having gatherings with anyone outside of your household, and only having one person from your household going out to get essential supplies at any one time. People have also asked whether you can get COVID-19 from contact with contaminated surfaces. Yes, it may be possible that a person can get COVID-19 by touching a surface or object that has the virus on it and then touching their own mouth, nose, or possibly their eyes. But this is not thought to be the main way that the virus spreads. Following recommendations to wash hands frequently and to clean high-touch surfaces regularly can prevent transmission from surfaces. Symptoms of this disease are shared by other illnesses such as the flu. But the thing that makes this virus different, is that it's new. That means higher potential for quick spread around the world and around our country. Our bodies aren't yet prepared to fight a new virus, and there are no vaccines or proven treatments yet available. So there can be more people sick at one time. All of the things the Governor and I are asking you to do are meant to reduce the number of people sick at one time in Wyoming.
Thank you, Dr. Harris. And now I want to turn this over to Dr. Wheeler, who has some important revelations and thoughts about this particular disease. He is on the front lines. And so, Dr. Wheeler, please.
Thank you, Governor Gordon. I appreciate the opportunity to make some remarks and share my concerns and ideas with you all today. I'd first like to take a moment to say thank you today on Doctors' Day to all the physicians, nurses, hospital administrators and support staff, first responders, and law enforcement personnel all over the world who are doing pitched battle against COVID. These frontline healthcare workers are getting sick and dying at rates significantly higher than the general population. Yet we face these heightened risks with grim determination, and we honor our oaths of duty to fight for every life that we can. I stand here today asking the rest of you to help us with this mission. We desperately need you to stay at home so that we can stay at work. So my name is David Wheeler. I'm a neurologist in private practice in Casper, Wyoming, where I've lived and worked for the past 15 years. I'm also a small business owner, and I'm struggling like the rest of you to cover my expenses, and I'm wondering how much longer I can keep my company going. At the same time, I have another job, which is making sure that people suffering from strokes anywhere in the state of Wyoming have access to the best possible care. Like many doctors around the state, I'm working every day to try to figure out how we can adapt these critical services to account for the expected shortages of both personnel, protective equipment, hospital beds, and places for this care to take place. Along these lines, I'm today encouraging all of my physician and other provider colleagues to stop performing in-person clinic visits and to instead adopt the use of telehealth as much as possible, except in the cases of emergencies. At the same time, we are recommending as a society that individual providers cancel all elective procedures which are unnecessarily wasting personal protective equipment that needs to be preserved for the expected surge in patients to come. We members of the Wyoming Medical Society represent 600 physicians and PAs in the state, and we together vigorously support any and all efforts at the national, state, and local levels to encourage everybody to stay safely in their homes. We have seen over and over again the horrific effects on other communities of waiting too long to enact such policies. If we wait until people start to show up in our emergency rooms, gasping for breath, we have waited too long. If we do not act now, it is certain that we will use up all of the available resources for healthcare in our state in just a matter of weeks. Because of our smaller population, COVID is coming to us later than other parts of the country. This means that we've had more time to prepare, more time to encourage you to avoid personal contact and stay in your homes. At the same time, because of our small population, we are severely limited in terms of hospital beds, equipment, and manpower. When our doctors and nurses start falling ill, and this will happen, there will be no backup. If we let this happen, people will die alone without access to basic care. People suffering from everyday maladies like heart attacks, strokes, injured in car accidents, or coming in with appendicitis, they will die too because there will be no room for them in our hospitals. But this is a grim outcome, but we can avoid this if we start working together today. If we flatten the curve now, our hospitals will have more time to prepare. If we flatten the curve now, fewer people will be sick at any given time. If we work hard during this time to surge hospital capacity, at the same time slowing the spread of the disease, many more of us will make it through to the other end of this. All of us have been already and will continue to be affected by this pandemic. Businesses are going to fail, jobs will disappear, goods and services are going to become more scarce. But these problems can only be made worse if we fail to act now to flatten the curve and limit the death toll. My company, like yours, is struggling, but the health and well-being of my family, my friends, my employees, and my community is infinitely more important than the money that we are losing. And I bet most of you feel the same way. Thank you very much.
Thank you, Dr. Wheeler, and I want to thank the Wyoming Medical Society for their intelligent advice that has come often and thoughtfully. We are all in this together, and I think it's very important to stay at home and avoid gatherings. Dr. Wheeler and his colleagues are on the front lines, and if we look at the experience that has happened in virtually every other community that has seen this terrible virus, those are the people that get infected. And when they go down, because as Dr. Wheeler said, we don't have an extravagance of extra people that are trained in things like respiratory therapy and all of the specialties that are absolutely imperative here, we will lose those people and consequently burden our system even more. I did want to just take a moment or two to talk about some of the things we're doing to try to ease business. Of course, the CARES Act came out last week. We've worked, and I've spoken before about the ways that we're trying to expedite being able to file for unemployment insurance and the ways that we're trying to help small businesses secure loans. We'll continue to work on that. Auditor Racinas and her task force are front and center in that effort and have been working with banks. If there are issues about eviction or about mortgage payments, banks and others stand ready to help, and we want to hear from you if there's a continued problem. Today, I signed an executive order that allows businesses with a restaurant or bar and grill license to sell alcohol with takeout or curbside pickup orders. This is intended to help these businesses that are really taking a hard knock at this particular time. We continue to look for ways that we can help our oil and gas and energy industries. And today, I have to say, Trona and others are very much on our mind as we've seen business really across the spectrum decline. These are challenging times for Wyoming, and we will continue to do everything we can, not only for our businesses, but for the employees that work at those businesses. I want to also talk about that we have just opened up a series of what we call Layoff Aversion grants that help help impacted businesses, and the number of applications is growing quickly. but we're hoping to allocate additional funding to this program designed to keep employees employed. The Wyoming Public Service Commission gave every utility the ability to temporarily suspend disconnected notice and waive late fees for customers. Practically every utility operating in the state has done so, but that doesn't mean if you can, you shouldn't pay your bill. We have also approved more than 4,000 state employees to do telework, and I'm also particularly proud of state employees who provide essential services. Just last week, in the delivery of those 2,000 vials, with the folks at YDOT were able to get that done expeditiously in just one day. Really want to give them a shout out. Thank you very, very much. A couple of comments on our statewide efforts. Regardless of where you are, regardless of the circumstances, you need to stay at home. You need to respect social distancing. You need to practice exceptional hygiene. That doesn't mean that you have stayovers at a neighbor's house. That doesn't mean that you go down to the Dairy Queen and congregate. And that doesn't mean that you all go to the Walmart or some other store at the same time. That is a particularly large problem. And my particular interest at this day is to recommend that businesses take care and pace their clients as they come in so that we don't end up with large crowds gathering unexpectedly in a particular store, one store or another. This is incredibly important. If we can continue to work to flatten the curve, evidence has shown that we can defeat this virus before it becomes a challenge for the state. So I want to repeat, across the state, the recommendations are exactly the same. Stay at home, social distancing, only go out to get the groceries you might need, and make sure that you practice good hygiene. And I think I want to just emphasize the critical nature of your personal responsibility in this matter. There have been letters that have come on both sides. One, that we need to be more drastic in our actions, and others that are saying you're being far too drastic. But it is you, the Wyoming people, that can make that difference. If you act responsibly and not foolishly or selfishly, we can defeat this virus. Every person who can should be staying home, not walking around stores or at family meetings or at group outings. That's not taking your responsibility personally. And I want to reemphasize the existing orders we have implemented are designed to make sure that you take that responsibility, change your public behavior, and protect all of our health. I'm imploring every citizen to stay home and avoid gatherings. And with that, I would say let's open to some questions. I have one that was submitted from Olivia Kenna of Sweetwater Now in Rock Springs. How many test kits are there in the state, and what is the plan to get more? Dr. Harris.
Thank you. So again, I'd like to start by making the distinction between the supplies that we need to collect samples that providers need, and then the supplies that we have in our laboratory that are needed to run the samples. Supplies of both are limited. However, our public health laboratory was able to manufacture media to create over 2,000 sample collection kits that were distributed throughout the state last week. We will continue in those efforts. And then we have been working with our federal partners and exploring all avenues to get testing supplies that we need in our laboratory to be able to conduct the tests. This is important, though, but we're asking providers to send specific priority samples to us so that we can turn them around as fast as possible. Those are the types of samples that inform the treatment of severely ill and hospitalized patients, samples that can help us conserve our personal protective equipment, samples from patients that may have a particular public health impact, and samples from patients that are at risk for severe illness. So our priorities for testing are healthcare workers, so that we can keep them and their patients safe, hospitalized patients, patients or people who work in long-term care facilities or other communal settings, and people over 65 and who have underlying medical conditions.
And I want to commend Dr. Harris for her leadership in being able to ramp up the ability for us to do testing. It is extraordinary how much that has grown. It's also exciting to see that private labs are also stepping up and other opportunities are showing themselves. We're working on that on a daily basis. I also want to just give a quick shout out to really the folks at the Department of Health, also the folks at WYDOT and Homeland Security, all of whom are working 24/7 to make sure we have the supplies getting out to the field as best we can. One other question I have is, how is the state doing on other medical supplies such as masks and ventilators? When can we expect more supplies to come? As I said in my opening comments, we've had 2 shipments from the National Strategic Stockpile, and those shipments have gone out to the counties or are shortly to go out to the counties. We've also released some of the state county stockpiles, and I have been checking with not only our folks here in Cheyenne, but the folks out in the field, the Homeland supervisors, to make sure that they're getting the supplies they need. We don't have enough. You know, don't be wasteful. That's one reason why I support Dr. Wheeler's recommendation that we stop any elective surgeries. Is there a question?
Good afternoon, Governor. Jim O'Reilly, Bigfoot 99 Radio. Thanks for taking questions this afternoon. You said several times during the news conference that you are telling Wyoming residents to stay home. Yet I know 2 glaring contradictions exist. I wonder if you could address those. One is in Public Health Order number 2, the exception for livestock auctions where lunch is being served. I understand that many livestock auctions have it on video, not as many people go, but still, one lunch served sit down at a livestock auction in Wyoming is more than any single restaurant in the state can serve. And 2, state parks are open for business and are advertising on their website. And Bigfoot 99 learned this morning through a source in the eastern part of the state that state parks were doing excellent business this week with Colorado residents, and that stores, grocery stores in Lux and Torrington saw their supplies, their shelves empty by out-of-staters. So I wonder if you could address those contradictions. We're telling Wyoming residents to stay home, yet this exception to livestock auctions and the open door to Coloradoans or other out-of-staters to come in and do state parks during this time. Thank you.
Yeah, so thank you for that. The question that was asked really referred to 2 contradictions to the order of staying, not order, to the recommendation of staying at home. The first regarded livestock auctions, which serve a group lunch and people come together. You know, I'm aware of Sinclair Bull Sale, for example, is coming up, and that issue has been brought to my attention. You know, when we issued that initial order, the idea was that we could maybe get by with it. We're really encouraging all livestock bull sales. Most of them are now available online. You know, some of them go through Western Lives, some of them go through Superior, and we're going to encourage them to make sure they keep that at a minimum. As I say, that first order was done some time ago when we needed to think a little bit, maybe a little differently about it now. The second regards an issue that's happening really kind of around all of our borders. You know, we're seeing coming into Uintah County a number of Utah people. The particular question that was asked was, what about the stores in Niobrara County and Goshen County that are being people from Colorado coming in and buying out the supplies? What can we do to address that? My recommendation is that stores begin to pace that, make sure that we don't have all of our supplies going to out-of-state buyers. We have closed the campgrounds for overnight, and we have severely limited what Wyoming parks offer. They're still available if you want to go walk, but there is no overnight camping as of the next day or so. Thank you for that question, Jim. Next question.
You said either 15 or 16 people have been hospitalized, one has been intubated. I was wondering if you could repeat those numbers, and also if you knew where those people are, either by county or city.
I can let Dr. Harris, the information I had on the one individual is intubated came from a local source up in northeastern Wyoming. Please go ahead.
Thank you. So the question is, of the 16 hospitalized patients as of this morning, more information including their locations. And to be clear, not all 16 people are currently hospitalized. Just through the course of this outbreak, 16 people have been hospitalized because of COVID-19. The county with the highest number of hospitalized patients is Fremont County. They have the highest burden of cases as well, with the other hospitalized cases being distributed around the state.
Thanks. So there's not 16 people in hospital now, but there has been since the start of the outbreak. Is that what you said?
Yes, that's correct. 16 people hospitalized since the start of the outbreak. Some have recovered.
Okay, thank you.
Thanks.
I have a follow-up question on that. How many, we have an average length of stay in the hospital during those hospitalizations?
Thank you. The question was, do we have an average length of stay? I don't have that on me. We can certainly look at that. I do know that some patients have been severely ill, required intensive care unit level care, and have been in the hospital for multiple days and even weeks.
As a follow-up, are there any hospitals that have been at capacity, even with just 2 or 3 intensive care beds? And if so, what happens when a hospital is at capacity with so few beds? What's the long-term planning to help with that?
Sure. So the question is, has any hospital been at capacity, and what is the plan to, assist hospitals that are at capacity? And that's one of the very specific reasons that we're asking people to take all the precautions and social distancing measures that we're asking them to take, is to avoid those types of situations. I can't speak for any hospital. I don't know whether any has been at capacity versus not. However, the plan in those types of situations, in a normal situation, is if one hospital is at capacity, to be able to then transfer or move patients to other regional hospitals that may be able to serve them. Certainly, if all hospitals are at capacity, that becomes a problem. But again, we work on hospital preparedness through the healthcare coalitions on a routine basis. Planning for things like this. That hospitals within the healthcare coalitions have plans for dealing with surge management within their region. And then certainly looking at bringing other providers into the state, getting additional supplies as much as possible is something that we're doing.
Next question. Yes, Angus.
Thank you, Governor, and thank you for setting aside this time, and you too, Dr. Harris. Dr. Liddell, Teton County's health officer, wrote Saturday that the process of getting his stay-at-home orders approved in jeopardize our community. The cases of COVID-19 in Teton County increased 650% during that time, zero. Meantime, people from other states, some that are undoubtedly coronavirus refugees, fleeing major metro areas, have arrived in Teton County. Why did the state delay such a local order?
So thank you for that question, and I'll let Dr. Harris take it in a moment, Angus, but let me just state emphatically here, there is no difference in the orders that have been issued in Teton County and the recommendations that were made by this office. They do comport. We don't want people going out. We don't expect them to behave in a way that's foolish. It's their responsibility to do that. Some people suggest that having an order somehow makes the world safer, but when you have 6 pages, or in the case of Teton, or something 2 pages of exemptions, really there's none material difference between the two. You could say agri en place if you wanted to, and that would be French for stay in place. The language is the same. It's very important that people respect, recognize, and take responsibility for their actions. And that's the most important piece that I want to say. We have been working to make sure that counties who want to raise that level of concern can. And I'll let Dr. Harris speak to that. But just making it clear that if we're going to issue a shelter-in-place or a stay-at-home order, it is not going to have multiple exemptions. Let me repeat, it will not have multiple exemptions. It will be a true shelter-in-place order.
Thank you, and I'll just say, I have great respect for Dr. Riddell, and great respect for what Teton County feels that they need to do to protect their residents. We have been in very frequent contact with them to try to work on a solution that works for everybody. Limiting, these orders limit people's movement. That is a very serious and significant thing to do. And so I do feel that if it takes a little bit longer to make sure that we have exactly what's necessary to protect the public health, but that doesn't limit people's movement more than absolutely necessary, then we need to take the time to make sure that we get that right.
Thank you. Next question.
COVID-19 cases, and how close we are when we're talking about the pandemic curve, the peak of this curve, and we start to see that decrease.
Michael, did you?
She's asking about when we see results from the social distancing. How long does it take that to get?
Yeah, so I think the question was how long would we see it take to see the results of social distancing? Dr. Wheeler, do you want to take that, or Dr. Harris? Okay.
So what we're seeing in other places around the world is that it takes something on the order of 3 to 6 weeks for the curve to begin to bend towards flattening, meaning that you start to hit your apex or peak of the most number of new cases per day. And then there's an additional multiple week tail off of this. And it's very important to understand that even once you've hit the apex, you can't then relax your social distancing standards. If you do that, it will immediately start to grow again, and all the hard work and sacrifice that we put in getting up to that point will be lost, and things will get much worse again. So we're really looking at continuing social distancing fairly aggressively for the next 6 weeks or so, I would imagine, and then gradually beginning to relax it over the next couple of months after that.
So could you repeat the question, please?
So noticing studying Wyoming issue place now has to be social distancing. I was wondering if that's a bit of a source of frustration or stress, because you have been trying to get people to start, staying inside, to stay away from other people, things like that, and they don't really seem to be following that advice.
So the question is the recommendation frustrating that people aren't adhering to it as much as we would like? Is that, yeah. And what I would say, having gone up this weekend to Johnson County, what I would say is people are starting to pay attention. You know that they're the stalwarts that are trying to demonstrate something. I'm not sure exactly what it is, but they're trying to fly in the face of that, and I think they will find themselves at a very distinct disadvantage in time. The most important thing here is that I think people recognize how important this is. Any night that you want to look on the news, you can see these cases, you can see the collapse of patients, you can see how fatigued the physicians are, how stressed EMTs are. And so, you know, I think people of Wyoming, and I say this over and over again, the people of Wyoming know how important this is, and they are starting to change. Thank you. Next question.
Governor, this is Mara Abbott with the Bulletin. I was curious, so because of staffing and access challenges due to COVID-19, the EPA announced last week that it would be reducing the amount of enforcement and not penalizing companies if they can't adhere to environmental regulations. So in a state with so much energy development, is that a concern to you? And in areas of enforcement where Wyoming has primacy, will it be following the EPA lead or maintaining traditional enforcement rules?
So Wyoming does have primacy, and the question really is if the EPA demonstrated or suggested that we could reduce enforcement and it would reduce enforcement, would Wyoming be put in a difficult place? We have primacy, which means that it is our Department of Environmental Quality that enforces the EPA rules on most environmental regulations in the state. And I have talked with Todd Parfit, the director, just today about what this meant to Wyoming. It does mean that we'll probably reduce some of our field inspections. If it requires a staff member to go out and spend the night, particularly a night in a place that is a hot spot, we will probably slow down that kind of activity. But our offices remain open. We encourage people to reach the Department of Environmental Quality online. We have made extra capacity available, and we're looking at ways that we can facilitate that in the offices so that there isn't person-to-person contact. But we will continue to do the work that Wyoming needs to do, and we will continue to provide the enforcement that needs to be done. It just may be delayed. Thank you.
And another question?
Yes. So the question was from Seth, and it dealt with about specific equipment, particularly ventilators. I'm going to let Dr. Harris take that.
We have not gotten any ventilators shipped to the state as far as I'm aware. We are, again, working with our federal partners to obtain those, to obtain ventilators for Wyoming, as well as looking at other options outside of that, potentially more innovative options to get ventilators here. Certainly having more ventilators would allow us to take care of more patients as long as we had the staff to be able to operate those ventilators.
Thanks, and there's a question here.
Okay, so I know it's probably not a word concern, but I know that you said that businesses that typically sell alcohol
So the order just allows them to sell. The question was, have we opened it up to businesses to do curbside beer and liquor delivery with their food, and is there a limit to that? And the order simply just says if you've been able to do this before, you can do that as a curbside activity as well. So thank you. Next question.
Governor, this is Seth again. You said last week you're doing your best to avoid shelter-in-place order. Obviously, we've had a really solid uptick in cases since that last presser. Are you looking closer, and what would it take for you to issue that kind of order?
So Seth, let me just reiterate the point that I made before. It's more than language. If we have to go into a more advanced shutdown, we're not going to paper it with lots of different exemptions and all that sort of thing. And at present, Dr. Harris is the person who makes the recommendations. And as we see fit, or as county health officers see the need, they can apply to sort of take this up at the next level, and we can support that. But as you know, Seth, we have several businesses in the state, all of whom are doing their best to adhere to the rules that we are, i.e. social distancing, not congregating, being able to do their work. And trying as best they can to make sure their businesses stay afloat. And I'll give you an example. After last week's press conference, it was nice to hear from Adam Weatherby that he was able to keep his business working, and that his employees truly respected that, and they understood all the circumstances that would lead to that, and they were respecting that. So the point we're trying to make here is essential businesses need to continue, and people can respect the guidance that we've given. Next question.
Governor Gordon, Matthew Colton from Layoff here. Thank you so much for the service. You as well, Dr. Harris. I have a question, I believe, Dr. Harris, to follow up to the hospitalization numbers. Do those 16 include patients who've been admitted on suspicion of COVID or not yet returned positive tests? If not, is any tally of those patients who are in the hospital with respiratory distress but not yet fully counted?
Thank you. So the question was, of the 16 people hospitalized, were some of that, does that include people who were hospitalized with suspicion of COVID but not confirmed? No, those 16 hospitalized patients do have laboratory confirmed COVID-19. Monitoring hospital bed capacity and the types of illnesses that are filling up the hospital beds is something that we are doing and is an important way to understand. Given that we know that not all COVID-19 cases are being diagnosed, to understand what our hospitals are seeing and to help us prepare. Hospitalized patients, however, are one of those high priority groups for testing, and so we do encourage hospitalized patients to be tested and for those samples to be sent to our Wyoming Public Health Laboratory.
Thank you.
Next question.
Dr. Harris, this is Angus Silver from Layoff. The Centers for Disease Control and World Health Organization recently changed some guidelines that would allow saline solution to be used as a viral media, in place of a viral media transport. And I was wondering if that would make any difference in the amount of testing Wyoming would be able to do.
Thank you. So the question was, CDC put out new guidance about potentially using saline as something to put the swabs in to get the samples from where they're collected to the laboratory versus the media that we have now. CDC did put out that guidance. We do, of course, operate the testing under the FDA under an emergency use authorization. We hope that emergency use authorization will be updated to include that information within the next couple of days. Of course, since now our preferred viral transport media is viral transport media, that is one of the reasons that we made it and distributed it out so that people could use that. We do have to make sure that saline, works, and that we can trust the results that we get when using saline. And so when the FDA updates that EUA, that will be our assurance of that.
Is there a follow-up, or?
Dr. Harris, Jim O'Reilly, Bigfoot 99 Radio. Has the Department of Health investigation into what happened at the assisted living center in Lander yielded any results as to patient zero, how the coronavirus, this novel virus, showed up at that isolated assisted living center in one of the far reaches of Wyoming when it did?
Thank you. So the question was, have we been able to detect patient zero or find the source of the coronavirus infections in the assisted living facility in Lander? We did go up there and did an extensive investigation. In these cases, it's unlikely that we're ever going to be able to find a specific source, and that is why it indicates that there is community transmission, in Fremont County in that area.
And Governor, just a clarification for my earlier question about state parks. As of yesterday, the state parks website was still advertising overnight stays for a reservation for yurts and other overnight camping. Did you suggest that was going to come to an end in the next day or so?
Yes, Jim, I did. That is a concern. We just like some of the orders that we've seen, we want to have people feel they're able to go out and enjoy the outdoors. We don't want them putting family gatherings out there. We don't want them congregating. And it was a recommendation of parks that if we closed some of these campgrounds, actually all of the campgrounds for overnight camping, that we would help to kind of push that kind of activity out of the parks. So thank you for bringing that up.
Thank you, sir.
Next question. Well, if there are no more questions, thank you very much for being here today. I want to reemphasize how important this is. And I'm sure all of our prayers are going out to not only those affected people, but to the doctors and first responders who we are counting on to be able to give us a fighting chance in this war that we have against the virus. And I would also thank our neighboring states as they are providing some facilities for medical conditions that we can't support very successfully in this state. So I particularly want to thank Governor Bullock and Governor Noem, both of whom have patients that are from Wyoming right now. So with that, thank you. Let me leave the same message that I began with. Stay at home, practice good hygiene, don't gather in groups of more than 10. Make sure that you take care of yourself, call your neighbor, and avoid any unnecessary travel. And please, stores, please don't let big masses come into your stores. That's really an important thing for you to start to establish a pacing on the customers that come to your stores. And thank you for what you are doing in limiting the amounts of supplies that customers are able to take. We're in this together. God bless you. Thank you very much.